This week on Africa Health Check.
Wateja walipunguka kabisa, wateja walipotea, ujui mali wameenda, mtu hata muonani, mpigani simu.
Nima ko dundee metti na ci dëkk bi parce que ñun bagage yu bari mënatul wàcc affaire yi ay ñu ngoy yokku da ngay bëgg frontière yi tëj yu bari.
We analyze the impact of a COVID-19 pandemic.
Our mental health awareness level now is very good because before COVID-19 people were not able to go to access those services.
On the mental health of many on the continent. Good day and welcome to Africa Health Check, where we reflect on Africa's response to the COVID-19 pandemic. I am Khokhontlejang Paladi. Ever since the outbreak of COVID-19 and it being declared a public health emergency, many people have been battling mental health challenges while trying to cope with the effects of the pandemic. Some people have had to deal with losing jobs, losing loved ones, having to stay in isolation for long periods of time, and overall having to change our lifestyle as we were trying to adapt to the new normal. On today's episode, we will be discussing the effects of COVID-19 on mental health. But before we do that, let us have a look at Africa in numbers. With the continent having over 10.5 million reported infections and approximately 236,000 reported deaths, countries have attempted to ramp up vaccination across Africa. This week in Africa in Numbers, we highlight the current vaccination rates on the continent, where we see Seychelles leading the pack with 78% of its population fully vaccinated, followed by Mauritius at 71%, Morocco at 62%, Rwanda at 49%, and Cape Verde rounding up the top 5 at 44%. For more on these African statistics on the COVID-19 pandemic, go to the official Africa CDC website. And that is our Africa in Numbers for this episode. Our guest panelist for today is Dr. Daniel Letswalo, who's a clinical psychologist and lecturer from South Africa. We also have our usual commentators, Dr. Marianne Morathi, who is the current chair of the Department of Medical Microbiology and Immunology and a senior research fellow at the University of Nairobi in Kenya, as well as Reverend Anthony Achampong, who is a pharmacist and a pastor from Ghana. Before we hear from these experts, let us have a look at this episode's feature.
My name is Chimemwe Zindondo. I'm a psychosocial counselor by profession. I'm a gender activist and also sexual and reproductive health youth champion. And also I am a founder of an organization called We Empower 265 based in Lilongwe, Malawi. When I was 20 years old, I undergo a certain situation that needed psychosocial counseling. But with the circumstances that psychosocial counseling is very expensive, I failed to access to the services. So that time I was doing business administration, but I had to change my career thinking about that poor somebody from the village. So it made me change my career because I really needed the counseling. But with the help of my parents, I underwent the situation. But for now, I do it for those people who are very poor. Our mental health awareness level now is very good, because before COVID-19, people were not able to go to access those services. But now, because of coming of COVID-19, a lot of people are passing through mental health issues. So at least the mental health awareness is good, because even the government of Malawi is joining the civil society organization to tell people more about mental health and where to access the services. COVID-19 has brought a lot of issues, because there is closure of schools, universities, and even some people, they have losing their jobs. So because of financial hardship, a lot of people are passing through a lot of stuff. So COVID has brought a lot, and the loss of loved ones, which makes some people to pass through a lot of stress. So COVID has brought a lot, and it has destroyed a lot. As we Empower 265, we have a project that we are doing an online counseling sessions. So first of all, we did an awareness so that the young people should know about what we are doing. So now they are able to access, because we can receive calls, text through our WhatsApp page and also Facebook page. So at least we have reached to a lot of young people. We have seen a difference. We Empower 265. The 265 is country code for Malawi. It's a youth-led organization that supports adolescent, young people and women in terms of mental health, issues of sexual reproductive health. So basically what we do is we facilitate information sharing, because here in Malawi most people don't like reading. So as an organization, we simplify those documents like the laws, the strategies, so that at least our target group should be able to understand what is happening in the country and also outside Malawi. So we are working with a lot of people at community level, because what we want is to empower those communities at least to fight for their own rights. I would like to encourage young people across Malawi to at least take this opportunity to access to the services that we are doing. They can reach us via our Facebook page. There is a poster there. They will get numbers and directions where to meet our psychosocial counselor.
And that is our feature story for this week. Truly inspiring stuff. And now I want us to dive right into the discussion. Remember, we are talking about the effects of COVID-19 on mental health. I'm going to start with our guest panelist, Dr. Letswalo. Please introduce yourself. Tell us who you are, where you're from, what is it that you do?
Okay. Thank you. My name is Dr. Daniel Letswalo, and I'm a clinical psychologist and both a lecturer from South Africa. And I did my PhD with the University of Limpopo. So I'm currently working both as a clinical psychologist and as a lecturer as well. And my area of interest includes neuropsychology, mental health, sexuality, and indigenous knowledge system to a certain extent.
Wonderful things, Dr. Letswalo. Maybe, today we're focusing on the effects of COVID-19 on mental health. Maybe we could just start with what have been your observations over the last almost 2 years of the COVID-19 pandemic regarding people's mental health and general well-being.
I will say COVID-19 hit everyone as a surprise. I think everyone didn't expect it. And within the past 2 years, what I have observed as far as mental health is concerned is that you realize that there were increase in depression. Obviously, people lost jobs. There were, threat in terms of the sense of security. When we were living our lives normally, and then all of a sudden something comes that can threaten your sense of security. You start asking yourself, am I really safe? And even those who were actually going through mental health issues already now, their problems are now getting exacerbated. So those people who are going through anxiety, those who are going through depression already, that becomes a problem, because this COVID-19 did not only come in terms of exacerbation of mental health, but also the economic effects of that. So that can also exacerbate what people are going through as people are losing jobs, as, there is a halting or sometimes of the supply of medication, certain services not being easily accessible, and quite frankly, just wearing a mask, it's quite an adjustment. And some people find it hard to actually adjust. They'll be saying, I can't breathe well, I can't do this, I can't do that. But overall, we realize that the pattern of mental health issues has been on the rise since the emergence of COVID-19.
Absolutely. And I think one of the things we're struggling with at the beginning, when it was declared a public health emergency, is that there was so much hysteria that was caused by misinformation and just deriving information from social media that was misleading. So there was this hysteria around COVID-19 that was also escalating, mental health issues. I don't know how, as a healthcare professional, you were managing to deal with such cases of mass hysteria.
Yes, lucky enough, I'm from South Africa, and I can assure you, we do have a lot of services available, and sometimes we will even go on multiple platforms to actually raise awareness in terms of what is to be expected. So people had to understand that it is okay when something abruptly happens to have a certain level of anxiety, but immediately when that starts impairing their functioning, then that's where it becomes a problem. So people were getting this awareness in terms of what is it to do, what to do, or where to go in case they start experiencing certain things. So therefore, lucky enough, as I said, in South Africa, we do have multiple services available. So people were able to know what to do and where to go. And we even have agencies where actually people can call in, where they can get on-the-spot advice in terms of what to do.
So maybe I'll just go to Dr. Marianne and maybe ask the same question. How were you helping people cope with COVID-19 just at the beginning when there was so much confusion, hysteria, and misinformation, and people had so much anxiety about what is happening and the changes that we had to adapt to so quickly in our lives? So maybe just share in Kenya some of the initiatives that were undertaken.
Yes, so in Kenya, there was a lot of panic, hysteria, and a lot of misinformation on what we were facing, what the virus was. And as a department at the university, we took charge in terms of breaking down to everyone. We lobbied broadcasting services who came to us, or we went to the studio, and through radio, social media, and television, we were able to educate masses what to do, what we are facing, what a virus is, let's start from there, and how to protect ourselves. We went on TV and also did a lot of publicity on even how to wear a mask properly so that people were aware on what to do, washing of hands, and also we were part of a committee that was also advising the government agency, the Ministry of Health, on how to mitigate the COVID pandemic. That really helped in breaking down to everyone what we were facing, making sure that we understood how to mitigate and protect ourselves. And when now a vaccine was also produced and available, we were able to educate others what to do and where to get the vaccine.
Absolutely lovely stuff. I'm going to go now to Reverend Achempong. I believe that raising awareness and addressing mental health issues is not only the duty of those in the medical field. So maybe you can just share about what you, from the religious spectrum, were doing just to support people cope with the mental health challenges during such a very difficult period.
Yes, it's quite unfortunate that probably not only Ghana is a victim or fell short in this area, that there was no government, or let me say specifically that the Ministry of Health didn't put out any information for public education. So people went by their own in the internet, on social media, and radios to source information on what one would consider as a mental health issue. The church, rather, where the religious leaders are received, they have good way with the people, took it upon themselves to publicly stand in their pulpits and then develop materials through their social media platforms to educate their people on how to prevent it, social distancing, wearing the mask, hand sanitizing, and all those kind of things. And they were bold, they were courageous. Why? Because the greater number of our people believe in some deity. Now, faith is subjective. Faith is very powerful, based on people's personal paradigms, convictions. But when they have experiences, their own experience to back them up, you can't write them off. So when somebody says that they believe that there is a God, there is a spirit that can help them in these conditions, they lean to their spiritual leaders. So this is where most faith leaders did extraordinary good jobs by educating their people, apart from people by themselves going to the TV stations and radios to source information rather than the government. So that is how, in the religious world, in my part of the world, that is Ghana, that's how we help people with information.
Thank you very much for sharing that, Reverend Anthony Achampong. We're going to discuss more of this, the effects of COVID-19 on mental health, on the other side. But now it's time for us to go for a quick break and hear what people had to say on the streets.
Ça a perturbé tout par rapport au contrat qu'on devait signer avec certains partenaires, par rapport aux affaires que nous pouvons avoir avec d'autres partenaires. Donc, on a été vraiment affectés. Moi-même.
It's a very big problem due to the situation going in Nigeria right now. You know, it shut down many places, many business, and some workers they were unable to go to work. You know, and it is hard for some people to feed.
Wateja walipunguka, tujawaona kwa macho. Coronavirus imebadilisha kila kitu mpaka nyumbani. Watoto shuleni, maisha hapa kwa nyumba imebadilika, vyakula, mavazi.
And that is the word on the street from this episode. Now we're going to continue my discussion with these experts. Remember, we are discussing the effects of COVID-19 on mental health. Just before we went for a break, we were hearing our experts share the initiatives that are in their countries to help people cope with mental health challenges during the pandemic. And I just wanted to ask Dr. Marianne, what are some of the major mental health challenges that you sort of picked up or that kind of were exacerbated by the pandemic over the last 2 years?
Some of the challenges, or the biggest challenge, particularly being on the front line, was the burnout that many healthcare workers developed. And this burnout also led to severe mental challenges. And also now, coupled with the burnout, was in the front line, the availability of PPEs. We're dealing with a new virus as well. So there was a bit of uncertainty when it came to the nurses who are facing these patients on a day-to-day, minute-to-minute circumstances, and also the doctors that were also uncertain how to deal with this infected patients at the front line. And what we saw that because of this lack of awareness, information, and the novel virus that we're dealing with, it led to some mental challenges, mental breakdown, coupled with a burnout. Also, coupled with that, we also dealt with mental challenges with the patients themselves. Remember, they were in isolation. They were alone facing this virus. They were away from their families. If they needed to see their families, it was either through the telephone or through WhatsApp. And again, that led to also some mental health challenges. For people who are then facing or taking care of anyone who was infected and then succumbed to the infection of COVID-19, we're dealing with death. And again, there was a bit of challenge of how to deal with the death of someone infected with COVID-19. How are we going to deal with the body? And again, I remember that was a huge discussion in our country. The Ministry of Health had to then consult pathologists, virus experts to be able to guide mourners, to guide the family, what they could do the number of people that could attend these services, and also deal with the emotional distress that the close family members had to deal with. So these are some of the mental challenges that I personally came across, being at the front line, being at the research world, trying to address a new virus. Many people came against us saying, we don't know what we're dealing with, it's new, and we had to reassure them we've been studying these viruses for many years, so we knew a little bit on how the body is going to handle it, on how to handle viruses, and what mitigation measures were there. So it's still an ongoing conversation, an ongoing challenge, and it's an open conversation on how to, first of all, dispel information and then deal with the challenges that come with the mental health or mental distress that has been elicited by this virus.
Absolutely. You raised a really important point about mental health support that is needed for frontline workers, healthcare workers, and you're actually reminding me of an online movement that I've been following that is #HealTheHealer. Dr. Letswalo, at the beginning of COVID-19, just after it was declared a public health emergency, we saw so much hysteria because of miscommunication, misinformation, and people just being so confused, and this led to people just having a lot of mixed emotions about the pandemic. So according to your observations, what would you say have been the major mental health issues or challenges, among different age groups as a result of COVID-19 and its effects?
Exaggerated level of anxiety, that uncertainty. There was a very huge uncertainty which was brought by COVID-19 across all age groups. And you look at the young, it's all about, as I said, the sense of safety was threatened. And now you're asking yourself as a young person, do we even have a future here? So those kind of questions and contemplation that goes on within their psyche is actually contributing towards, that exaggerated sense of or level of anxiety. So the anxiety was the main issue. Then what followed was now depression that is actually induced by that anxiety, because now you develop this certain way of thinking, which is brought on by the anxiety. And then therefore you finally that cripples you in terms of your functioning, your daily functioning, occupational, personal wise. Then therefore it slowly but surely develops into a condition.
Absolutely. I'm going to bring in Reverend Achampo now. I'm sure as a religious leader, you also receive a lot of people seeking support for different mental health issues, challenges or matters, broadly speaking. Maybe you can share what were some of the major cases you came across or had to deal with regarding mental health matters during the last 2 years, basically.
Yes, apart from bereavement, which Dr. Marianne has commented upon as a result of the COVID, fear, anxiety, depression, I believe that one area that people have actually struggled, in Ghana and I believe in Africa, is loss of employment, economic loss. And to the African, somebody has remarked that to the African, mental health is when you don't have money. When you don't have money, when you are short of finances, everything goes spiraling around. So that is even though our government made some interventions, relief packages, took off electricity bills of people, paid the water bills of people, distributed food across the board, people are still suffering. We're finding jobs and finding money to feed their people. Let us forget about the breadwinner, the father, the mother dying off. Everybody is suffering in this country, whether it's in the church or in the public. So the message across is let us support one another, and that nobody should be allowed to suffer alone. Regardless of background or age, because social isolation coupled with poverty can be a very terrible thing in a situation like COVID-19. Yeah. So the churches and communities are putting themselves together, volunteer groups, just to support one another, especially in the area of finances and job seeking and job situations. So
that's true. Dr. Letsoalo, you've done extensive research work on your field, just overall speaking, and not just in the context of South Africa. What is the level of accessibility, affordability of mental health support services?
I will not contextualize it, as you say. I will just talk about the African continent as a whole. On this aspect, I'll have to agree with the referent that it's not as well received. We actually want it to be. So we'll have to do more in terms of actually conscientizing people to the concept of mental health and what needs to be done. But as I say, this is within the basis of the African continent, because as the Reverend has already said, the perception of what mental health is among Africans is quite something else. I realize that the perception of the whole concept of mental health is different, you know, as the referent also touched on it. But you can see it is still an upcoming field, and actually people still need to be conscientized a lot to it and what it entails and the significance of it, and to what extent it can actually help curbing the ills of the African continent.
Absolutely. And as we wrap up the show, I want you, Dr. Letsoalo, to have the parting shot, and I want you to speak to anyone listening to this right now on the role that we have to play as members of society, members of community, in reducing or even eliminating the stigma that is attached to mental health matters.
First of all, I'll start by saying that it can happen to anyone. The most important thing is for us to understand that it can happen to anyone. It can happen to me. It can happen to anyone else. So you can't say because today I'm a clinical psychologist and therefore I'm buffed from actually, experiencing that. It can happen to anyone. But the best we can do is to actually offer support to those kind of people. Know that if you offer support to me today, you might actually need that support tomorrow, because what I experience today might actually be a problem tomorrow. So therefore, we must work as one. And I think the referent also touched on this. We must work as one while we are in this journey of conscientizing each other, but we also have to walk alongside each other. Through that journey, we will also be able to learn from each other and therefore be able to develop African-based strategies of how to carry each other hand by hand moving forward, so that we can be able to maneuver such difficult times.
Absolutely, and totally in agreement. Thank you so much, Dr. Letsoalo, Dr. Marianne, and Reverend Anthony Achampong once again for your time and sharing your knowledge and information. And please keep on doing the tremendous life-changing work that you do in your respective countries. We have come to the end of today's show, and I just want to say you do not have to struggle or suffer in silence. Make sure you do reach out for help. It is not a sign of weakness. It is rather a sign of strength to be able to reach out to us for support. Make sure you connect with Africa Health Check on all our social media platforms. We will be very happy to hear from you. Until we meet again next time, same place, same time. Remember, the future is Africa, the future is today.